Sekhokho sa vaccination.
One of the things that in terms of the pandemic preparedness, we have seen the way the country treated sex workers during COVID, where sex workers themselves were not even allowed to work. So these are some of the things that we took into notice, and we have seen that sex workers themselves, even if we wrote a letter to the president to say, can you also, in one of the aids that were given out, were like the food offering, everything that the country did, also can you also include sex workers? And that on its own, we have seen like, for example, your corporate like ETV went into the space and they literally like also donated food parcel to sex workers, because we understand that some of them brothels were closed, places normally they would operate, they couldn't even work in the street, and we're talking women who supposed also to be mothers, who supposed also to be our brotherly and sisters who were like literally out of any means of making money. But as the movement, that on its own, it wouldn't just be something that we're just going to ignore, but it's something that we have learned to say now sex workers must also start saving money, making sure that they have bank accounts, making sure that in such incidences where, like, for example, another pandemic can hit, then they're able to say to use whatever savings or the resources that they have as a backup. But again, one thing that I love now, currently we're doing, the movement is also now literally making sure homosexual guys, they start farming. Those who have at least a piece of land, they start farming. Because one of our members was saying, Katlego, I didn't know it's so easy to kulisa spinach. So these are some of just the basic needs that we're also teaching them to say, this is how you need to prepare. But the last one, which is now the prevention around the pandemic. Globally, we're not sure which one is going to hit first, because we have seen, I think in the past 3 weeks, we were like, there's another COVID that is about to happen in China, but they said it's not yet a scare, but it can be anything in terms of the pandemic. Like right now in South Africa, we feel like TB is also a pandemic that the country needs to decisively deal with it, because after COVID now TB is a pandemic, which is especially in the mining areas. That's where now you see lots of TB infected people are in there. And the last one, our response as a movement towards the pandemic that's happening in the country is to say we would like, number one, if our government can just do a simple thing, which is just to remove the criminalization element on people's behavior, especially people who are say, I'm an adult, I consent, I'm not forced to do what I'm doing. Remove the criminal element so that people can fully access the constitutional rights. And some people, but when you mean it that, so it doesn't mean that it brings solution, but criminalization of sex work on its own, it's a huge pandemic to sex workers that needs also to be dealt with, because it's a violation of human rights, it's a violation of people's body autonomies. It's like the state takes fully control of how I utilize my vagina, how I utilize my penis. Then I need to be policed around that. These are some of the things that even for us to respond to certain things, due to the law, our hands are tied.